Hello everyone, this is Dr.T.S Subashini from the Department of Pharmacology, SRM Dental College, Ramapuram. Today, in this video, we are going to see about teratogenicity. Teratogenicity is the adverse drug reaction caused by a drug when it is consumed by a pregnant mother. Not all the drugs taken by a pregnant mother are safe to the mother. There are so many drugs that will tend to easily cross the placenta and reach the fetus and tend to produce unwanted effect to the fetus. These unwanted effects can be noted either directly in the fetus or after the childbirth. The effect can be seen in the newborn, or as the child grows also the teratogenic effect can be marked. So a pregnant mother should be having a good knowledge about the drugs that are safe to be used in pregnancy. In this video, we are going to see certain teratogenic drugs and what are all the effects that are caused by those drugs. Phocomelia is a teratogenic effect caused by the drug thalidomide. Thalidomide was given in 1960s and all for the pregnant women for the case of to treat morning sickness. So it has got antiemetic property and mild sedative action. So thalidomide was prescribed. But later on, during the post-marketing surveillance, thousands of women who consumed thalidomide during their pregnancy, they gave birth to the child with seal-like limbs. So seal-like limbs, that is referred to as phocomelia. So the limbs, shortened limbs were seen. So while prescribing a drug, the physicians were not aware of this phocomelia, but later on they found out this teratogenic effect. So phocomelia remains the most striking limb deformity caused by thalidomide and remains the stereotypical image of thalidomide embryopathy. Phocomelia occurs through a severe shortening of limbs due to the proximal elements, that is the long bones, being reduced or missing and leaving distal elements, that is hand plate, in place. So the next picture shows the cleft lip and cleft palate. So this cleft lip and cleft palate are caused by so many group of drugs. Phenytoin, which is an anti-epileptic drug, warfarin, which is an oral anticoagulant, and glucocorticoids, which is a anti-inflammatory and immunosuppressant hormone. So these drugs are totally contraindicated in pregnancy. So glucocorticoid, except for the lung maturation of the fetus, glucocorticoid should not be used in pregnancy. So likewise, if a pregnant woman who is a epileptic patient, or in pregnancy also sometimes some people may develop epilepsy, so in those cases and all, better not to use phenytoin and all as an anti-epileptic drug. So this picture shows the tooth discoloration caused by tetracyclines. So this tetracycline is totally contraindicated in pregnancy. If a pregnant mother takes tetracycline, definitely the tetracycline will tend to form a complex with calcium and phosphate, and because of that it will tend to produce teratogenic effect. So it will tend to affect the growth of the fetus. Apart from that, as the child born, when the tooth start erupting in the child, definitely tooth discoloration will be a significant aspect seen that occurred mainly because of the usage of tetracycline by the pregnant women. And next important teratogenic effect is the spina bifida, that is the neural tube defect. So this is spinal cord with spina bifida. So the valproate exposure prevents the morphological and biochemical conversion of the caudal extreme of the PNP during late spinal closure. So this is the main reason for the development of spina bifida. So likewise, this valproate and carbamazepine are also this anti-epileptic drugs. So they should be totally avoided during pregnancy. But when a pregnant woman gets exposed to these drugs after the closure of the PNP means, then there will not be a significant spina bifida. So it's the duration during which a pregnant woman is going to take the drug that also matters much in the case of teratogenic effect. And next is the fetal alcohol syndrome. Suppose if a pregnant mother is having a habit of consuming alcohol, definitely this alcohol will tend to cause fetal alcohol syndrome. So this fetal alcohol syndrome, it will be significantly seen in the newborn. One thing we have to keep in mind, this is totally irreversible in nature. So the fetal alcohol syndrome not only affects the physical growth of the child, and also the brain development of the child also will be affected. So small eye openings, smooth philtrum, thin upper lip. So these are all the significant manifestations you can see in the case of fetal alcohol syndrome. So pregnant mothers, so there is no such specific quantity that can be considered as safe for this alcohol in pregnancy. So the pregnant mother should be she should totally avoid consuming alcohol. So in our next video, we will see about some more teratogenic drugs and the adverse drug reactions caused by them. Thank you all.